At this time, I would like to introduce you to our speakers. Lee Elliott spent most of his career to this point in management of hospitals. He also has taught management and psychology at a variety of universities. Over the past 16 years, his primary focus has been on developing an approach to management that produces exceptional business results and enriching places for people to work. Recently, he began to refer to this addition to management as wisdom-based. Lee Elliott is a management consultant for the Wonderful Life Project. Our second speaker this afternoon is Leslie Marsh. Leslie Marsh is the CEO of Lexington Regional Health Center, a critical access hospital in Lexington, Nebraska. Under her leadership, the hospital has received several national awards for quality and patient satisfaction. Leslie is a registered nurse with a Bachelor of Science degree in business, a master's degree in business administration and management, and health policy from Yale University. In 2015, Leslie was awarded the 2015 Nebraska Rural Health Achievement in Excellence Award. She is the president of the Nebraska Rural Health Association, and next year, in 2018, Leslie will serve on the National Rural Health Association's Board of Trustees. This year, 2017, Leslie was awarded the Nebraska Hospital Association's Excellence in Service Award and has been recognized as one of the 130 Women to Know in Hospital and Health Systems by Becker's Hospital Review since 2015. Now, I'll turn it over to Lee and Leslie. Take it away.
Hi, all. Let me start off with our very first slide here. Okay, I have it coming up. Yeah. Where we're going to start talking about what's going on with labor supply. And really what the focus of our talk today is how do we keep enough staff? In the healthcare world, it's not easy. And in fact, if you look at the entire labor market right now, we're seeing that we're going somewhat in the wrong direction. 71% of people at work say they really don't care for their job. They want to go to work someplace else. 68% are saying not engaged. And the challenge with that, we're spending right now, I just read the other day, roughly $750 million a year to increase employee engagement in this country, and it's going the opposite direction. That's obviously a failed effort. The Edelman Trust Barometer, if you've not seen that, that's very definitely worth looking at. I would suggest doing an internet search for that. First time, the survey, and it's surveys done every year throughout the world, it said trust is dropping so low that it's reaching a level of crisis. In addition, Society of Human Resources Management, or SHRM, is again confirming employees are disengaged. They're saying they're not motivated, they're bored, they're stressed. Right now, the stress levels in our nation are such that we're spending about $300 billion a year for stress-related conditions. We're missing, rephrase that, we have about 1 million people missing work every day because of stress. That's 60% of our absenteeism. If you do quick math on that, productivity drops 2.5% for every 1% of loss in absenteeism. You're going to have about 2.5 million days of work per day that we lose in this country due to stress. It's reached a level that very high levels of reporting even being burned out, saying basically they're essentially done. Unemployment. If we take a look at this little beauty, starting back in 2000, unemployment was fairly low, and we kept puttering along in the 4 to 5% range and going, pretty good unemployment until we hit the Great Recession. About 2007, it began to kind of percolate. 2008, it really got going, and it just exploded. We saw the unemployment double. Well, that has now corrected itself. We're back down to basically what we were back in 2000, 2001, in those areas. In fact, we're approaching very near to full employment. 4% is full employment. That's the point at which people are just moving around, they're checking jobs, looking at things. You get below 4%, life starts getting tough. For example, where I live in Sioux City, Iowa, Woodbury County, we're currently running 2.1%. We just did a check just a few weeks ago, If we hired every single person that's unemployed in Sioux City, Iowa, we would still have 3,000 jobs open. And this is not a heavily populated area. So it's a big concern. To the point right now in the nation, we're running about 6.1 million jobs just standing open, waiting for the right people. As I said, we had a little bit of magic. If you look at the cartoon, something extraordinary happened in that the Great Recession hit, because we were not in the world's best shape. I was doing a lot of work in the hospital I was working for at the time saying, how do we get more people? And we were struggling with this. The Great Recession hit, life got a whole lot easier, and now we're back to where we were. There are some rumors out there that artificial intelligence is going to lead to a drop of about 30% of currently employed people, but that's not much in this country. That's mostly in the heavy manufacturing places like China and such as that. Okay, future labor supply predicted by Goldman Sachs is grim, 3.5%. That's 2 years from now. Actually, a little over a year from now. We've not seen this level of unemployment since 1968, during the height of the Vietnam War. The last time we saw 3.5 unemployment was 1968, and I just checked that out about a half an hour ago to make sure my numbers are correct. Okay, let's look at healthcare. I looked at two jobs. RNs, we're looking at 14 to 60% growth between 2015 and 2020. That's about 1.1 million RNs needed. Half of those are replacement. Half of those are for new jobs. Bad news, while we're expecting this growth in demand, we have over 50% of our nurses are within 15 years of retirement or less. We would anticipate if the labor supply was equally distributed across age groups, that'd be more in the range of 30%. So this is almost double what you would anticipate. This will cause troubles. I also looked at med techs. I've been watching this particular job since about the year 2000 because I began to see at that point in time things were not very easy to recruit med techs. Demand's going to grow about 22% over that same time frame. Unfortunately, we're only training about half of what we need, and most of that is due to the fact that we've closed schools. Add to that, 40% of lab techs are within 10 years of retirement. We've got a really serious mess, and it's going to get a lot worse in a fairly short time. The question we have to look at is how is healthcare and other employers going to address this? It turned out that I was working at a hospital, medium-sized hospital, back in the year 2000, and I encountered this exact same problem then. We simply could not get enough people to do the job. In December of 2000, we sat down as an administrative team and said, how do we handle this? And the conclusion was, the strategy was we would create a work environment that was so wholesome and enriching that when people heard about it, they'd want to come to work at our place, and when they got there, they wouldn't want to leave. At that point in time, the whole administrative team looked at me and said, okay, take care of that. I have to tell you, that was a long day because I really didn't know how. I did not have a clue how to do that. I began to talk to the people, the employees. They told me, look at conflict. Help us with this. We've got a real issue with the problems we're having with conflict here. People get upset in fights. The upset doesn't go away, and they tend to, at some point, leave. Can you help us with that? About the same time, I didn't know this at the moment I started in 2000, 1999, a guy named Martin Seligman was president of the American Psychological Association, and he said, why don't we create a psychology for the typical person? We don't have one. We have one for abnormal psych. We have developmental psych. We have people like me, industrial organizational psych, but we don't have anything for the typical person on the street. Why don't we create a psychology for them? In the year 2002, that began to be applied to the world of work, and some refer to it as positive organizational scholarship. It's got other names, but that's the most prevalent name that I've seen. I began to get into the research, and I'm very research-oriented. That's been my focus on this, and said I won't put together anything that is not research-based. Decided, in fact, based on discussions with the employees, for the most part, to start training people on how do you have high-quality conflict, which is a bit of an unusual name to say high-quality conflict. That's not something people think of as a matter of course. Important to understand, if you're going to have high-quality conflict, that in fact, a conflict is a problem wrapped in distressing emotion. The difficulty is the distressing emotion. If it's just no distressing emotion, it's simply problem solving. Unfortunately, the distressing emotion takes problem solving into a different domain, and we treat it so much differently. We start doing things like the most common approach to conflict is to avoid it, which in fact means the problem just stays. It's going to be stuck in that organization for as long as the problem is around. It's going to have to go away on its own because nobody's doing anything to get rid of it. Okay? The second most common approach is dominance. Well, experience has said, you know, dominance does not necessarily yield optimal problem resolution. In addition, it creates leftover hard feelings, which creates problems all on its own. So dominance is a defective approach, just like avoidance in a different way. Compromise, the third most common approach to conflict resolution, is in fact also flawed in that the optimal outcome you can hope for from compromise is in fact to have both parties half unhappy with the outcome. What we're saying is none of the three most common approaches to conflict are effective. In early 1980s, there was another approach that began to be talked about at the Institute of Negotiation at Harvard. Fisher and Urey wrote a book called Getting Past No, and it was striking. Began to change things. They started talking about the interests, and the best way that I can convey what an interest is to tell a story. I had a lady come to my office about as angry as I'd ever seen anybody. She was beyond furious, was clenching and unclenching her fists. Her jaws were working. She was highly distressed. I had never seen her like this. She was really a very kind soul. Quite a surprise. I got the door shut. I got her to sit down. Finally, she told me, I said, why is it you were so upset? Because she was just really ripping into her boss, who was quite a good guy and a very good boss, which surprised me. In any case, in the course of discussion, she said she didn't get Friday off, and I thought, no, that can't be the whole story. So I asked a pivotal question. I said, why do you need Friday off? She said, at that point in time, after just dissolving into tears, I've just learned my son has a form of cancer, and I think he's going to die. And I got to get to the doctor, and I can get him in on Friday. I said, did you tell your boss that, why you needed Friday off? She said, no. He simply said, you've asked for too many Fridays off. I told you just like 2 weeks ago not to ask me for time off again for a while. And here you are, literally 2 weeks later, coming to my office asking for time off. The answer is no. You cannot have Friday off. And then I lost it. And I said, well, would it be okay if I called your boss? She said, sure. So I called him, and after listening for a few moments to this gentleman telling me how distressed he was by her conduct, I asked the question of him, did you ask why she wanted Friday off? He got real quiet. It was as though the phone almost died. He said, is it bad? I said, yes. He said, I'll be right there. He came running to my office, literally, from the far end of the building, puffing into my office, came in, shut the door, sat down, took her hand, and said, why do you need Friday off? She told him and just collapsed. As he's holding this lady who's sobbing, he looked at me and just shook his head. Yeah, I understood the message was, I didn't think, to ask the question, and I royally messed this one up. The interest is the boy's dying. She needs Friday off to care for her son. The position she wants Friday off is the most common level of conflict resolution and doesn't work very well for that very reason. That was the breakthrough in 1981. We started doing things interest-based, and we began to discover conflict worked much better. Add to that, we talked about those distressing emotions. You can soften those emotions. And one of the most incredible tools to do so is to listen. research shows we're only about 25% effective at listening. If, in fact, we use good technique of listening, emotions tend to soften fairly substantially. Now you're moving in the direction of problem solving. We taught people how to do interest-based negotiation. We taught them how to soften emotions. We taught them how to use tools to make the conflict go more effective, such as go slow to go fast. At the end of a conflict, it's very important you slow down. Not uncommon. That's when you're going to hear the most telling comments, and really very common to hear the real reason you're there at the end, what seemingly is the end of the conflict, but obviously it's not. We found, in fact, when we got done with the conflicts, and I was doing lots of mediation, doing a lot of training on how do you have good conflict, there still was hard feelings, residual frustration. I thought I knew the answer. I came in on a Saturday and said, you know what, I'm going to go to work on this. I'm going to find research on forgiveness, because I won't do things that are not research-based. I want to find research on forgiveness that will tell us how do you deal with this. I found it. It took quite a while. Fred Luskins of Stanford went to Northern Ireland. He taught Catholics and Protestants how to forgive the person who murdered their family member and got stunningly good results. It was absolutely amazing. I thought, you know what, we can adapt this. And we did. I put together a training program on forgiveness, and nobody showed up. So a colleague said, why don't you call it grudge busting? So I did. And we got a full house. Learned the value of marketing right there. And that became our most popular training program. We taught people how to put things that hurt them in the past. The beauty of this is when you do that, you find yourself in a situation where you're not thinking about last week's conflict with that guy when you're entering into a conflict at the moment. You don't carry past hurts with you. The net consequence, you are in a state of peace. What Luskin found, I'll give you one tidbit of information. Obviously, I can't teach you a whole lot about all these things because there's a lot of content to this. But what Luskin said is one of the most difficult elements of our existence is the fact that we have rules for other people's behavior. He called them unenforceable rules, or shoulds. They have to do what I say. They must do what I say. They should do what I say. He said that is the foundation of all conflict, and it's an error in how we think. One of the ways to reduce grudges is to show people how to think differently. As simple as that. In fact, you'll have less conflict. We found about a 30 to 40% drop in the amount of conflict we had when we began to teach people how to not, using Luskin's terms, should on other people. How to keep people from demanding that we behave a particular way. When we've done this, we find organizations' quality of conflict tends to change quite a lot. The first two together, conflict and grudge busting, we refer to as being at peace, yet standing up for yourself effectively. The next category, I actually stumbled onto a Reader's Digest article, and son of a gun, I found Martin Seligman in there. I had met him when I was an undergraduate at Virginia Tech, graduate student at Virginia Tech, and got to chat with him a little bit. I was impressed. And it talked about this research that I mentioned before that he was doing on positive psych. In particular, he was studying happiness. I thought, unbelievable. In my lifetime, I see people researching happiness. It was there. I dug into it, and the stuff that is there is so good. We find things like Robert Emmons at the University of California. He's got about $8 million worth of research going right now on how to be thankful, how to count your blessings. We're finding, in fact, it is a very, very powerful way to increase happiness. This research on happiness has become powerful enough that the Financial Times of London has said, in fact, this is not just a little momentary blip in the realm of management. This is going to stay. They said, even if you're a Scrooge and all you care about is money, you need to start paying attention to employee happiness. I will also tell you, if you look at happiness and you look at the impact of job satisfaction or engagement, a better predictor on results in the organization is happiness. With that, The biggest source of happiness, it turns out, is friends, relationships with others. At the core of relationships with others is trust. Remember I said a moment ago that our trust levels are crisis domain, they're in the crisis domain? We're pretty bad. We start teaching people how to trust. Found very good research on this. The big one is, well, not the big one, the big three. To be trustworthy is to be able to produce whatever you promise. You don't make a promise on something you can't come through on. Next up is integrity, and that's one where you don't unring a bell. You don't get a day off from integrity. But if you really want to grow trust in an organization, and this surprised me, it is benevolence. Benevolence is kindness with no strings attached. We begin to emphasize kindness in our organization. And I mean, quite seriously, even put it into our performance appraisals, and found people were doing it. They were being kinder to each other, being more considerate of each other. The place began to become calm. The place began to be a nice place to work. With that comes resilience. Resilience is, according to the researchers in this field, the foundation of everything positive. If you're going to be able to have anything positive in your life, you must have some degree of resilience. Having said that, it's all based on how we think. Literally, there are thoughts we have on an ongoing basis, and when we make errors in that thought processes, it causes us grief. A should, an unenforceable rule, is an example of an error. Another is filtering. If I give a talk to, 50 people, 49 say great talk, one says, oh my God, I focus on the one. That's filtering. I've said if university football team wins 49-1, they'd be ecstatic, but for some reason, when I give a talk, if I engage in filtering, I would focus on one and not the 49. There are a variety of other errors we make that are fairly consistent, and they're really quite easily fixable, which increases people's resilience. The flip side of resilience is stress. We talked about that. It's really reaching a point that we have an epidemic. They're now referring to the conditions that come about as a consequence of stress as the diseases of civilization. The estimates right now, and this is coming from the American Stress Institute, are somewhere between 80 and 90% of the healthcare conditions we see from our patients are stress-related. They're either caused by stress or made worse by stress. As we said, the cost on this is just phenomenal. We talk about how does this happen? How is it that a simple thought, the thought that I can handle this, leads to a release of glucocorticoids out of the adrenal glands, hits the brain, the net consequence are reductions in serotonin, dopamine, and norepinephrine. Serotonin goes down. We, in fact, get locked into the dark side. You just can't hardly give up dark thoughts. Dopamine goes down. There's no joy in Mudville. You're not going to be very happy if you don't have adequate levels of dopamine. If norepinephrine goes down, you don't want to get out of bed in the morning. Robert Sapolsky, is a neuroendocrinologist out of Stanford, has said this is depression. This is what's causing us to have depression, and we're reaching epidemic levels of depression, and it's getting younger and younger. When I was young, many years ago, the average age of onset of depression was about 27. Today, it's 14. Serious issues. We've got fundamental issues with stress. The 4 training programs, happiness, trust, resilience, and stress, we called Learning to Enjoy Your Life. By the time we're into this level of training, we have seen substantial drops in turnover. And it didn't come about as a consequence of the Great Recession. We literally, when you look at the turnover, it began to drop in 2001, just a little bit, 2002 a little more, 2003 a little more, and just gradually declined until 2010, until I quit doing this work at St. Francis where I was at. We had a minister come and give a talk on ethics, and I realized we had done nothing to keep our place from getting caught up in the behavior of Enron. We could have happy people, we could have pretty good conflict, we could have very little stress, and some pretty rotten behavior going on. And we thought, we need to do something about that. decided, in fact, to teach people the psychology of ethics. I wasn't going to teach people what was ethical and what wasn't ethical. That was for other people to do. My job, I saw, was to teach people what are the stages we go through as we become increasingly moral in our behavior, and how do we think differently? How do we approach life differently? Found some pretty striking stuff. The big one we found is, what does science say constitutes good? Very important finding for us. And with that, we found, what are the social psychological things that happen in the world that when they occur, we get into some real serious trouble. From there, we talked about the big one. The ultimate goal is, in fact, for all of us to reach some state of fulfillment, to say life was good. I'm happy with my life was meaningful, I made a difference. I studied this. How I did this, I went to nursing home administrators, and asked them, what is the biggest concern you have about the elderly? You've worked with people, these were very experienced nursing home people and long-term care people, and I said, what causes you? You know these people. What causes you the greatest heartburn? And almost to a person, they said the same thing. That is, the vast majority of people get to the end of their life and say, my life didn't matter. I really didn't do anything of any consequence. We decided to take it on to see if, in fact, there wasn't something we could do to increase the likelihood of people reaching a state of fulfillment in life. We began to train on things like a different way to think of money, of economics. The classic economic theory, if you studied that, is, if we're maximally greedy, we'll get the greatest return for the most people. Turns out that's not true. We've had all sorts of demonstrations. One of my favorite was Dan Ariely was at MIT, and at the student union, he put out like little Starburst candies. In the tray, or with the tray, was a sign that said 1 penny apiece. When in fact, people had to pay a penny. On average, they bought about 3 pieces of candy each. Then they periodically changed that sign with another sign. The other sign said free. Classic economic theory says the first guy comes through and takes the whole tray. In fact, they didn't. The average person took 1 piece of candy, and the reason for that is they wanted to have candy available for other people. So classic economic theory, and there's multiple studies showing this, doesn't work very well. We are at some level quite altruistic. That became very important. We began to look at the implications of things like the Protestant work ethic. If you work hard, the notion is you'll get to the end of your life and you will be, well, actually rephrase that. Before you get to the end of your life, you will be given great wealth. And if you don't work hard and frankly you engage in sinful behavior, the reward for you will be no wealth. So the amount of wealth you have is somewhat reflective of the amount of money you have. People didn't really understand that to be the classic definition of the Protestant work ethic, but it is. And when we get to looking at it, we find people don't buy it. And when we went further with this and explained to people a better way to think of the world is like what they found in a daycare in Israel. That is, they found, in fact, when they gave young people, rephrase it, when they gave parents a penalty for coming and picking up their kids late, the number of children that they came to pick up late went up. Classic economic theory says that was not the way it was going to be. They should have seen a significant reduction. It actually went up. And then the people running the daycare said, oh my God, we don't want that. So they pulled the penalty, and the number of people coming to pick up their kids late went up. What Dan Ariely, who's a behavioral economist, said is we are now in a situation where we understand there's really 2 sets of rules we operate under. When money's involved, it's an economic thing. Otherwise, we operate, he called them under social norms. These are rules we have for how we treat each other that are really quite altruistic. When we've gone back and looked at the people who came up with classic economic theory, they knew that, were advocating, and over time we somehow just forgotten that. We are in fact quite altruistic beings, and that works extremely well for those of us who work in healthcare, because that's the nature of the people who work there. We taught people how to achieve a state of fulfillment. From there, looked at Transcended Change. John Cotter of Harvard has says the vast majority of change models we use are lousy. They stink. Get about an 80% failure rate. We need to do something different. He studied, rephrase that, he didn't. Bob Guyon at Ross School of Business at Michigan studied Gandhi, Martin Luther King, and Christ and said, what did they do? They got massive change over a multitude of years. How did they get this to happen? And based on what they did, he developed a different approach to change, which works in situations like that. From that, we taught people to write a strategic plan for the rest of their life, for their entire life, not just work. And it was quite telling. We saw some really amazing results. With that, let me tell you the results. That's a very quick overview of some extremely complicated topics. This all happened at the hospital I was at. I was at St. Francis Medical Center in Grand Island, Nebraska for 29 years. When I left there, we had about 1,100 employees. We were running about $150 million gross revenue and $15 million margin. What we did, we just designed trainings for groups. And we trained group after group after group. And then we did extensive one-on-one coaching. With that, we got some pretty impressive results. We were very happy with this. We got a 40% drop in turnover over the 9-year period as we increased more and more trainings and more understandings of how to do whatever it was we were doing. We saw the job vacancy drop down to 2%. I really got to a point, my recruiting was not running ads. Mostly I went around and told people what we were doing. And we got applications from the vast majority of people in the room when they heard about it. So we had accomplished what we'd set out to do. We also saw improved conflict. People were thinking about what is the problem and how do we most effectively solve the problem, and not getting so caught up in the distressing emotions accompanying it. And they learned how to deal with those distressing emotions so they weren't with us day after day. We had any number of situations where I was dealing with conflicts that were years old when we first moved into this effort. And in time, they began to go away. We saw increased happiness, and I'll tell you where we got it. We got the feedback about happiness was from the patients. They were quite clear in saying, your people are happier than we've seen before. What's going on here? We looked at how much did it save. Estimated cost per turnover in those days, regardless of title, just, the average, if you would, was $28,500. We were saving around $2 million a year based on that, with an estimated return on investment of roughly 11 to 1. From there, I should mention I did a training program in Grand Island. The whole community asked me to get involved. We had 1,600 people involved from 120 different companies. Things were going very well, and then I got a call from Leslie Marsh, and I'll let Leslie tell you about that.
So I started here at Lexington Regional Health Center in 2010, and there was one group of physicians in town, and they were all quickly approaching retirement age. They'd been unsuccessful in recruiting anyone for about 17 years at that point, and the board was very concerned. We did open up an urgent care and tried to work together on that, but ultimately all efforts to work together were rebuffed, and in October of 2014, all but one physician resigned their privileges. So as we began to think about next steps post-crisis, we knew we needed to plan. We didn't want a critical situation to worsen. Hoping that systems, processes, and cultures won't fail, as the 2010 oil spill showed us, doesn't work. We needed to intentionally and systematically address culture, communication, and the immediate trauma to set everyone up for success. And we knew that leadership was critical to our successful transformation of our culture. We were already involved in leadership development, but we needed to amplify those efforts. Having just undergone significant conflict and trauma, we needed to learn how to have high-quality conflict and how to forgive. While people, safety, service, quality, and finance were foundational underpinnings, we needed to create a virtuous culture in order to best meet our mission and attain our vision. We didn't just want to hold meetings and discuss the situation. We didn't feel that would be useful and that such an approach would fall far short of our intention to move past our recent experiences. We needed to focus on our people in a thoughtful and meaningful way, and we knew we needed help to do that. So we turned to Lee for that help.
Fortunately, back up. Leslie used the term virtuous organizations. I had just been reading about Kim Cameron's work at the Ross School of Business at University of Michigan. And he found that when organizations go through a trauma, like Lexington did, there's about a dozen things happen in an organization that you don't want to have happen. You lose creativity, your best employees leave, you get a lot of bunker mentality, communication drops, performance in general drops. None of those do you want. What he found, which was quite striking, was to the extent an organization is what he called virtuous, they didn't happen. I recalled at that point in time 2 layoffs that we had gone through. One in 1987, I was involved in a layoff, and we got all 12, every one of them. They're pretty ugly. In 2009, we went through another layoff, much bigger one, only this time we guaranteed everybody a job someplace. They didn't lose employment, they just didn't work for us anymore. And we got none of them. And we handled it a whole lot differently, a whole lot more compassionately. Cameron said the virtues that one needs to look at are listed here: forgiveness, humility, etc. We compared that to what we'd done at St. Francis and said it fits. The training programs we had cover most of these, enough so that we could create what he referred to as a virtuous organization, which is one that supports this virtuous behavior, which is, in his terms, the highest aspirations of us as people. The highest level of our existence comes from being virtuous. Now, bear in mind, we found, or he found, that when research is done on organizations that are virtuous versus those that are not virtuous, those that go through trauma have really adverse consequences. Those that are not virtuous, or that are virtuous and go through trauma, have virtually none of the 12. So Leslie at Lexington had gone through quite a trauma. It made sense that we would move towards a virtuous organization. And Leslie, you're on.
So how did our work pay off? In October of 2014, our gross revenue was the lowest that it had ever been at $1.8 million a month. Currently, our gross revenue ranges from about $3 to $3.8 million per month, and we didn't increase our charges during this time. We did add 2 rural health clinics in addition to our urgent care clinic, which I already said opened in 2011. But our market was a new market. We had captured the market that used to leave the community, but we needed the Medicare population to use our services as well when it made sense to do so. As you can see on the slide, we continued to move the needle on patient safety and service excellence. This calendar year, we have focused on our swing bed utilization, and both swing and inpatient census is normalizing. So we're finally beginning to regain our Medicare market share. One way we were able to do this was to ensure that we did what we did because it was the right thing to do. This goes back to Lee's comments about being benevolent. We wanted to be able to help the community heal without thinking about how that might impact our organization. We wanted to do the same within our organization. We wanted people to know we cared, period. While benevolence was the goal, the virtue did in fact impact our operations in several key ways. So while we did really strive to be benevolent, we certainly did impact operations. We became a place where people wanted to work, just like Lee said about his experiences at St. Francis. People in the region were talking about us in a positive way. And while Nebraska and the country are experiencing severe nursing shortages, we do not have any vacancies, and we've added services that require additional staff. We partnered with the University's Medical School and began a residency program. Physician recruitment is gaining strength. The medical students that are rotating through our organization are talking about our culture and are actually helping us to recruit. And we couldn't have accomplished any of this without Lee's help in transforming our culture. We've worked with Lee for 3 years now, and as you can see, Lee's work helped LRHC to attain some of the successes he's just discussed. He's already talked about the curriculum, but just hearing about a curriculum doesn't begin to do Lee and his work justice. Lee is benevolent. He is virtuous. He was never just selling a product. He cared and helped our team become passionate about purpose, kindness, and one another. In a word, Lee is authentic. We learned how to use conflict to grow. Conflict is necessary and unavoidable. Being able to walk away from conflict with a solution to a problem and doing so in a virtuous way is pretty amazing. We still have lapses. We still have to remind one another to practice everything we've learned, but there's beauty in being able to have that level of compassion for one another and for the community that we serve. And importantly, we are able to work our mission every single day, and that just benefits everyone. Lee, I'll turn it back to you.
Okay. One thing that I would stress, Leslie was talking to the University of Nebraska Medical Center a few weeks ago about recruiting nurses. They said at this point in time there is one hospital in Nebraska that has no openings for RNs and has a waiting list of applicants, and that's Lexington. It actually, everything we set out to do back when we tried to create that work environment that was so wholesome and enriching that when people heard of it, they wanted to come, and when they got there, they didn't leave, was exactly what was happening at Lexington. It happened at St. Francis. We began to see it develop in the community in several of the businesses in Grand Island in the work we were doing there. I'm working with others, and the results have been consistently positive. We've not seen any go south. I've been very pleased. I'm working with a place right now. I'm 1 year in, just beginning to get preliminary feedback from people. They're saying things like trust is higher, calmness. The doctors had a meeting. The business office manager told me the doctors had a meeting there the other night, and she said they laughed. And the meeting only took a half an hour. She said, I've never seen that here, and I've been here quite a while. Several things like that happen as we start teaching people how to best address these complex, difficult people issues that absolutely devastate our organizations, that are most worthwhile, both from a business perspective and from the perspective of people. We find, in fact, that if people are finding difficulties in life at work, they take 4 times as much stuff from work home as the other way around. Say that again. We take 4 times as much stuff from work as the other way around. If you think how much stuff comes in the door from home, 4 times as much as going home. So if the work experience is an unpleasant experience, and 71% of our people in the nation are saying work, you know what, it's not so cool. I'd like to go to work someplace else. They're taking that home, and that's diminishing home lives. If we improve life at work, I repeatedly get told it's improving life at home. Most worthwhile. Last summer, I decided I was going to dig into this and say, what is it we're dealing with? I don't know about you folks, but Positive Psych doesn't tell me anything. Positive Organizational Scholarship, not really. On something of a whim, we named the little effort I had the Wonderful Life Project, based on the Jimmy Stewart movie. That's just how it got that. That doesn't tell me either what it is. I had an obstetrics director come to me, an OB director came to me many times as I was working at St. Francis and said, Elliott, I need some wisdom. And I began to wonder, is this wisdom? And I thought, well, I don't know that much about wisdom. I need to look into it. As a consequence, I got a hold of the Center for Practical Wisdom at the University of Chicago and began to read. I found exactly what I was looking for, the criteria for what is and what is not wisdom. I decided what I would do is I would very skeptically write myself a paper and say, is this wisdom? And given the reverence of this term, the importance of this term to us, I didn't want to treat it lightly. So I spent the whole summer. At the end of summer, I reached a conclusion, and that is, yes, the case is made. This is wisdom. This is a study of a training program on the fundamental pragmatics of how we live. With that, we'll take questions. What questions might you folks have?
Thank you so much, Lee and Leslie. This was a fantastic presentation. We do have one question, actually two questions from Justin. The first one, I think is addressed to both. And as we're answering these questions, participants, please do contribute to those final two polls that have just popped up on the screen. Presenters, Justin asks, what was the first step in achieving the 98 employee satisfaction with where they work? How satisfied were they before any change was initiated?
At St. Francis, it wasn't too hot. We had some difficulty. We were working hard. It was a good place. I'd been there. I worked there 29 years, and we had a management team that I was really impressed with. They were excellent people. And in fact, when I started there in December of '81, we could not get a bank to make us a loan because we were that broke. We had to borrow from the mother house to make payroll. So by the time in the year, 99, 98, in that area, when we began to have problems with recruiting, and then when 2000 hit, it really got bad. That was causing a lot of strain. I'm not sure that our job satisfaction at that point in time wasn't, in fact, somewhat diminished by virtue of the fact that we were having trouble getting enough staff because people were tired. They didn't get weekends off, and it was a mess. When we started changing things around, we hit top of the nation twice over that 8-9-year period I worked on that for employee satisfaction.
That's fantastic. So can you identify the first step that you took to achieving that high employee satisfaction?
Started talking to the employees. Said, what do we need to do? I can't tell you how many meetings I had. I talked to hundreds of people. We had, like I said, 1,100 people. I had a goal of trying to hit half of them at least and saying, what do we need to do? Now, obviously, I didn't talk to them one-on-one. We had big meetings and everything we could do to get people talking. And I walked the halls and said, tell me, what do we need to know? And I'll tell you, the mother lode was the long-term employees. We had a group we called the 30-year-plus people. You could only get in that group if you've been employed at St. Francis 30 years or longer. Boy, do they tell me. They told me. They're the ones who said, well, Elliott, why don't you help us with conflict? People are quitting because they get in fights. They don't know what to do with it. Then if they do try and address it because they're not good at it, they often make it worse. You're like a mediator. Why don't you do mediation in-house? Why don't you teach us how to have better conflict? And I thought, that makes perfect sense. And that's how it all started.
So for me at Lex, when I started here, our employee satisfaction, we did a survey, and it was about 66% said that they would recommend us as a place to work. So we knew that we had some work to do, and again, that it is about understanding that without your people, you're really nothing, and so investing in them, and I think authenticity cannot be, overstated. So I think, certainly Lee gave us the tools to really be able to show that and to become more virtuous, but really listening to people and showing them you care and getting out of the way for them to be able to shine is really important. And leadership development, that's where all of our leaders, said, we're committed to this, we're going to do this. And it did make a real difference. People did feel valued, and our patients felt that as well. So it really is about just making a connection, and then making sure that you let others know that you appreciate what they do, and sharing that with the community and with other parts of your team. Don't take all the credit. To just let others know what everybody does and how important it is to everybody to work together.
If I might, Leslie, what was the last score on your people's willingness or desire to encourage other people to come to work there?
It was 98%, I think, was the last one we did. And when I first started, we had a lot of turnover. Turnover was at 23%. There was a lot that we needed to accomplish, and again, it really is just about truly valuing your employees, listening to them, and working together.
Leslie, one more question for you from Justin. Did Lexington pay the RNs more than other hospitals in the area? Was compensation never an issue with retention?
Initially, that's exactly what we thought it was. So when I first started, we're like, we're just not paying enough, and I think that's the real issue. But that's not the real issue. We don't pay people more. In fact, we do pay people market. I mean, we pay people what people are making in the region, but we do not emphasize pay, because we want to make sure that it's more rewarding, that people are here not just for money, because those people can also leave for money as well, and that's not really, it wasn't a good fit for our organization. So no, we don't pay any more, and we pay less than many others.
Great. Thank you so much, Leslie. For those that are staying with us for the remaining 8 minutes of the presentation, if you have questions at all, please do press *2 to unmute your phone line. You can chime in verbally or also use the chat box on the left-hand side of the screen. We have a few more minutes available for questions, so please speak up.
To fill the void just for a moment, I see a question just popped up.
Yes,
besides employee turnover, besides employee turnover, what other key metrics do you track? I tell you what I do, and I've been told I need to measure employee satisfaction or employee happiness and things like that. I said I just track business variables. What changes in turnover? What changes in job vacancy? The stuff you're already measuring, that's what's most important. If it's on your organization's key metrics, if those don't change, it really doesn't matter to a certain extent how much employee happiness goes up, because if you're not getting good business changes as a consequence, it's not going to be sustained. Fortunately, every place we've gone, we had good business changes. So I don't advocate. I mean, you can measure trust, you can measure all those other sorts of things, but I found it quite easy to walk the halls, and they'll tell you how much they trust you, trust the place. They won't necessarily tell them how much they trust me, but how much they trust the place. Pretty easy to find out.
And we measure things like, do you feel like you're listened to? Do you feel like you get the resources that you need? Do you feel like your manager gives you credit? Do you feel like your manager responds to your needs? Do you feel like we're visible? We do ask the question about trust, those sorts of things. And that's on our employee survey that we do annually. But in terms of just overall, we look at, market, we look at finance, we look at what's our turnover, we look at vacancies, we look at all of the markers that you would look at under, quality and service excellence as well. So we're looking at how do our patients feel about us, et cetera.
Awesome. And Kim isn't able to connect verbally, but Leslie, she is requesting, if you're willing to share your employee survey questions, please do